Hi, everyone. It's Dr. Azi here. Welcome to the More Than a Pretty Face podcast. Hi, everyone. Welcome back to part 2 of dermatologic diseases. If you have not tuned into the first segment, it was on last week. So we're going to jump right into finishing up this segment with answering more of your questions.
Before we jump into questions, Dr. Azi, you were so excited to talk all things skin.
I
all
love
things skin
dermatology.
diseases.
And
This
what
is
can I say? I love dermatology. I'm
This
so
is
passionate about it.
so passionate, and it shows.
It's such a visual field. You know,
Mhm.
everything from looking at the skin, looking at the patterns of, whether it's discoloration or a rash or breakouts, it's all visual. And then we also take the skin sample and we look at it under the microscope, and I can almost look at a skin and in my head, I know what it's going to look like under the microscope. It's just a really cool field in that sense that, just this whole, algorithm to it that I feel like I've built up, over decades. So
Yeah.
it's enjoyable for me. I love it.
I love watching your passion because you are literally like a Rolodex with all this information. You just spitfire everything 1, 2, 3, back to back to back.
Yeah.
And it shows. You can see your passion, and I love that.
Like my husband says, I try to like chime in on another topic. He's like, just stick to dermatology.
Oh, that was gonna be my next question. Like, do you know anything else? Like, are you passionate? Are you knowledgeable like this on this extreme with anything else?
Yeah, I know construction.
What?
No, I have built a house from the ground up. Like I can tell you foundation, framing, insulation. I can
How have I never known this about you?
I
What?
love that too, actually.
You
Like,
built a house?
yeah, so my dad is actually an architect, and yeah, I think
Okay.
that building a house, there's a lot of creativity in that as well. And
Absolutely.
there's a lot of aesthetics and designing, puzzle. It can be visual as well.
Mm-hmm.
And so, yeah, I built a house and I really enjoyed it. And I think if I ever retire or semi-retire, I think that's what I would do, build homes.
I love that.
Yeah, I
You're not
love it.
retiring, so.
Probably not. I'll be like 92. Be like, okay, I
Gonna
think it's
build my
time
second
to
home.
cut back. We'll be on our 1,014th episode of More Than a Pretty Face.
Live at the construction site. I love that.
So,
All right, let's get into it. Our first question is from our Instagram story box. And honestly, I think we do need a little more information on this. This is a great response. Somebody wrote in, Dr. Shirazi, love your podcast. Could you please recommend supplements for vitiligo pigment?
yeah, so vitiligo is an autoimmune condition and it can affect, I think, up to 8% of the population now. Usually, half of the people that develop vitiligo will develop it before they're 20. And what happens is your body, your immune system, attacks the cells that normally make pigment, so your melanocytes. And that's why you see a loss of pigment. And a very famous model, Winnie Harlow, has vitiligo, and I love that she inspires so many people with skin conditions. She's this beautiful, successful model that's never, been defined by the disease. In fact, the disease basically went with her, in
Yeah,
terms of her success
she's
and so forth. And
gorgeous.
she has a great sun care line, actually, K Skin, that I'm a fan of. So I digress. But in terms of supplements, so that's a really good question, actually. A recent study in 2021 looked at all these different supplements on the market just to see if they actually have any benefit in people with vitiligo. And they looked at 62 manuscripts. They did 26 studies that were reviewed. And the conclusion was the supplements traditionally used are things like ginkgo, oral polypodium leucotomos, and lipoic acid, vitamin B12, vitamin D, folic acid, and other combined herbal bioactives. Although they saw really growing evidence to support that these could potentially help with vitiligo, they couldn't really come up with a conclusive answer of whether
Interesting.
they would have any benefit or not. So I don't think it, hurts to take it, but it's not there's not a lot of solid evidence. Now, the most promising therapies was using oral phenylalanine as an adjunct with UVA therapy, which we do a lot of with vitiligo patients. We use a UV laser, actually. It's called Excimer, which uses UVB, not UVA, but this can help with suppressing that immune system to help prevent the skin from attacking its own pigment producing cells. So there is some promise with that, but there's really nothing that, yeah, were you going to say something?
The oral supplement or
Mm-hmm.
medication that you named, is that a supplement or is that an actual prescription medication that you take in conjunction with the laser
Well, there
or
are a
light?
lot of photosensitizers that we use in dermatology to help, like PUVA, to help with skin conditions. And
Mm-hmm.
so you take it by mouth, makes your skin more sensitive to UV rays, and then we expose the skin to UV. A traditional one is PUVA, and so that is something though that it's not something you would take on your own. I think it's something you would do under the direction of a dermatologist. So ginkgo is another one that you could potentially use as monotherapy, but the jury's still out for some of these phototherapy herbal supplements. But they seem to show the most promise.
Mm-hmm.
Maybe they somehow make that UV therapy more potent or more effective. But there are great treatments now for vitiligo, topical treatments that help with suppressing specific areas of the immune system and preventing it from attacking the body, really.
Yeah, I feel like vitiligo's been around for so long, but maybe in the earlier stages it was deemed more of like a cosmetic concern, right?
It can be a cosmetic concern, but in the areas that you have the white areas, they are depigmented, meaning you have no melanin, so no protection against the sun, which if you have a lot of large areas affected, you can get burned like really easily, much more so than type 1 skin. So it could be potentially more than just a beauty condition per
Right.
se, but a real medical condition. So that's the dangers of having vitiligo. Now, there's one thing I will say: do not use coenzyme Q. It's in a lot of firming lotions
Mm-hmm.
because that could actually make vitiligo worse. There's good evidence with that. So coenzyme Q, you want to stay away from if you have vitiligo.
Interesting. Okay, well, thank you for answering those. Our next question comes from Rory on Instagram, and they say, "Hi, Dr. Shirazi. I love your show. Thank you so much for answering all of our skin questions. I appreciate it so much. Can you please talk about alopecia on your podcast? I see you talking about PRP for hair loss on YouTube. Does this work for alopecia? My mother is losing her hair and it's very, very thin. I'm not sure if this is due to aging or alopecia, but she is also losing her eyelashes. What is the best treatment for hair loss, and how do we know if she has alopecia? Is there a test to take?"
Yeah, so
I
that's a
love
great
this.
question. People call alopecia areata, which is a specific type of alopecia,
Mm-hmm.
alopecia.
Right.
It's just generally known as alopecia, but alopecia just means hair loss. That means that you can have different types of hair loss, but I'm assuming she means alopecia areata because when a lot of people come into the office, they specifically are referring to when you lose patches of
Mm-hmm.
hair. All of a sudden, all the hair falls out in almost like a circular patch that then leaves the smooth skin with no hair behind. And it could
Mm-hmm.
be pretty distressing for
Oh my
people
gosh.
because all of a sudden now they've got these bald patches. Uh, it's important to have an evaluation. It's usually a clinical diagnosis. We really look at your scalp and your hair follicles. We can also take a skin biopsy, what's called a punch
Mm-hmm.
biopsy. We could take that skin and look at it under the microscope to make sure that it's not caused, for example, by a fungus that affects the hair and causes the hair to break. But alopecia areata is an autoimmune condition as well. It's very similar to vitiligo. Your hair follicles, though, are there, they just can't grow. So they're there, but they're being attacked by your lymphocytes, your white blood cells, and they unfortunately fall out because of that inflammation. So, very successful treatment, if you just have, a couple of patches, is doing injections with Kenalog, which is an immune suppressant, and you
Mm-hmm.
just, inject those alopecia patches with the immune suppressant. It allows the white blood cells to, lift, to go away, to
Mm-hmm.
stop attacking those hair follicles, and then you see the hair follicles grow. So I always really stress to patients that the hair follicles are there, they just can't grow, and we just have to get the white blood cells away from it. Now, if you are having alopecia totalis or universalis, this is when you lose
And,
not just in patches, like one or two patches, you're using your entire scalp,
mm-hmm.
and all the hair follicles on your body get attacked,
Oh, wow.
like your eyebrows, your eyelashes, your body
Mm-hmm.
hair, your all of your scalp hair. Now that could be quite devastating, and for that we would use systemic medications, oral medications, and these are known as a class of medications called JAK inhibitors, and sometimes they could be topical, compounded topical. Actually, we use them for vitiligo as well, but you could take them to help with that specific branch of the immune system that's causing this problem. But back to your question about PRP, does that help? It certainly can, because PRP is a lot of growth factors. And I also have people start minoxidil, even though minoxidil is just a hair stimulator, right?
Mm-hmm.
It's not going to do anything that is specific to alopecia areata, but it doesn't hurt. And so, yeah, you can do PRP as a way to heal the follicles at the same time as we are trying to suppress that immune system from attacking them.
Now, the injections should be done by your provider in a medical office,
Yeah,
but
don't try to do them on yourself.
please don't. But, it was interesting when you asked about testing as well. When I read his question, I think of more just like hair loss, but like you said, there's so many different types of hair loss. And when he asked about testing, what come to mind was the pull test.
Yes, so that applies to more like telogen effluvium hair loss or female androgenetic alopecia, which I go into detail on in my hair loss YouTube video. But in terms of alopecia areata, I mean, a lot of times it's like you don't even have to do a hair toss. It's like
Yeah,
it
you
just
just see
comes
it.
out. All of a sudden, you get a patch of bald skin. Hair loss is so complicated.
So
You
complicated.
know, everything from the pattern, the history, the timing, and certainly diet and your protein intake, your vitamins. We're seeing a lot of vitamin D deficiency causing
Mhm.
hair loss. Everyone says biotin, biotin, but really vitamin D is really important. Iron is really important. Making sure that you have a well balanced diet. Stress, going back to stress,
My gosh,
can really
yes.
have a significant effect, whether it's stress on your body or mental stress or physical stress. If you have a big procedure, if you have if you undergo general anesthesia, for example, that all could cause hair loss, months down the line. You don't see it right away. That's the thing. You don't see it right away. Like
Yeah.
women that have kids, they can experience hair loss from the stress of the
My gosh, the balding.
yeah, that
Yeah.
happens, when the baby's like 6 months.
Hmm.
Hormones. So the list goes on and on and on. So if you're not sure about the type, it's really important to have an evaluation, because the
Yes.
treatment always dictates the type of hair loss you're experiencing.
Such a good question. Okay, our next is from Jessica, and she writes, my boyfriend has one patch of hair, white hair on his chin.
Oh,
He is not graying, but has just this one patch of white, and it's new. what the heck could this be? That's a great question. That's actually really funny because my cousin, when he grows his beard out, he
Uh-huh.
just gets right here red hair and brown hair. And I
Oh.
always make fun of him. I don't understand it.
I don't
So
understand the
tell
red,
us.
but well, pigment in hair is variable, right? So some people have like light brown and dark brown and red and blonde, and that all depends on how much melanin or pigment is being produced by that growing hair follicles. My first thought, Jessica, is pull the hair back and look at the skin. If the skin is white, which I'm going to guess that it is, he probably has vitiligo. And because
Interesting.
vitiligo takes out the color in the skin, makes the skin white, it also makes the hair white. So anytime you have hair growing out of that skin that's white, the hair is going to be white as well. So that sounds like what it is. Now, it's not a big deal. It can be kind of cute. It can be annoying because I had a patient for the longest time. She would have the end of her eyebrows. I mean, her eyebrows were like dark brown and then just the ends were white. And
Aw.
it's because she had vitiligo on her eyelid, but you would never know it because she was type 1 skin. She was very, very fair. She
Oh,
was like
yeah.
as fair as you are. So in type 1 skin, you don't have a lot of melanin in your skin to begin with, so it's not that noticeable on the skin, but on the hair, it could be quite noticeable. So for that, if you have that, sometimes we can do in-office injections. We can do the topical immune suppressants for vitiligo. But it's something to talk to your dermatologist about. But
Could there be any other underlying conditions that would cause something like that?
is he secretly like bleaching that hair or coloring the rest of it? He missed a spot.
I love that. Okay, so just vitiligo.
Well, you could have like some people genetically, like I don't know if Jay Leno, Jay Leno is that
Oh.
famous comedian that
Mhm.
always has that white silver streak.
Mhm.
Some people do have that. I mean, maybe you have a group of hair follicles that aged much faster than the rest of your, than the rest of your hair follicle genes, and so as our hair follicles age, they get lazy and they don't produce as much pigment, and hence you get the white hairs. But it's because the hair's follicles not producing pigment.
Interesting. All right.
So,
I love it. Our fourth question is from Instagram. I'm going to keep her name private on this one. We have here, hi, Doc. Could you please help question when someone does not have herpes vessels visible, can it still be present in saliva and get transmitted to partner during kissing? Thank you. Kind regards.
yeah, so cold sores, a lot of people may not realize, but they are caused by HSV, which
Mm-hmm.
is the herpes simplex virus. And it's a virus similar to like the chickenpox virus. It goes and hides in your nerve roots. And with certain triggers, like if you're stressed or if you have a lip injection or a laser treatment with me, for example, or if you're out in the sun, it causes that virus to come out of the nerves and onto the skin and causes the vesicles, the little fluid filled little blisters that you see on the skin. And once you have it, unfortunately, you have it for life because it sort of goes and hides. You can't really ever get rid of it. Traditionally, HSV2 is the virus that affects the lips, and then HSV1 is the virus that affects the genitals. But now, after decades of being around,
Mm-hmm.
the two are mixed. So you
Crossed.
could
Yep.
have, and you could imagine why that is. But so you could see HSV1 or two uh,
Anywhere.
anywhere. So you can have viral shedding without having an active sore. It is possible.
Mm-hmm.
It's more likely for you to get it if there's blister because the virus is in the fluid filled blisters. But that's why I say be careful about sharing lipstick or drinking after someone because they
Mm-hmm.
may have the HSV shedding.
Yes.
It's possible, yes, and you can shed it in bodily fluids like saliva or vaginal or
Secretions.
genital
Mm-hmm.
secretions. And so you can be transmitted. Now,
Treatment.
treatment wise, if you're prone to them. Now, some people get them every time they're out in the sun or every time they have a procedure with me in the office. it just triggers it. So you could take it prophylactically, meaning you can take the medication, which would be either acyclovir or valcyclovir, so that it never shows up. It sort of stops it from ever coming out of the nerve root. Or you can take it on a daily basis. If you're one that is getting them like every other week or every month, you're getting these cold sores, you can do continuous suppression with the oral medication. There's also like a Abreva topical you can use, but ideally you'd want to start the medication as soon as you feel it. Some people can just feel it. They get like a tingling sensation, or they get itching. They call that the prodrome. It's almost like people that get a migraine. They know it's coming. Then you can take valcyclovir. You can take a gram of that. You could take 2 every 12 hours. So just 4 tablets for 1 day, and it sort of stops it from ever coming out.
Yeah. In OBGYN, we would always start our pregnant patients in their 3rd trimester on prophylactic, taking it every day just so that they wouldn't have an outbreak at the time of delivery.
Yeah, because that could be really terrible, especially if you get it in the eye, for example, as the baby's coming down the vaginal canal. That would be devastating.
Oh my gosh, these were such good questions, you guys.
Yes, thank you so much for tuning in. And if you found this episode valuable, don't forget to share this with a friend, because sharing is caring. Until next time, be sure to follow us on Instagram at More Than a Pretty Face Podcast. And if you're listening to this, take a screenshot, tag me in your stories at Skin by Dr. Azi. Thanks, guys.
Bye.
Bye.